we've all been there, right? Waking up with that dreaded red eye staring back at you in the mirror. Pink eye.
Oh, yeah?
It's like a rite of passage or something.
Yeah. The struggle is real.
But what most people don't realize is that pink eye is kind of a catch-all term.
It absolutely is.
Yeah.
It's like saying headache. There's so many different types of headaches.
Right.
And they all have different causes, different
Right.
treatments.
It's true.
And just like with headaches, knowing what kind of pink eye you have is key to figuring out the best way to treat it.
That's such a good point. And that is exactly what we are diving into today.
Let's do it.
You sent us this really interesting article about pink eye, and it covers everything.
Yep.
It covers the different causes, the symptoms, the treatment options, but especially the eye drops.
Yes. And you know me, I am always here for a good deep dive into treatment options.
Just always.
Because, let's be real, that's where things usually get a little confusing for people.
Oh, 100%. It's overwhelming. So the article mentions that what we commonly call pink eye is technically called conjunctivitis.
Right.
Which, honestly, I have to say, it sounds way more intense.
It does, doesn't it?
Yeah, conjunctivitis, I need to go to the ER.
Right. It sounds like a very serious medical diagnosis.
Okay.
But really, it's just a fancy way of saying you have inflammation of your conjunctiva,
Okay.
which is that thin membrane that covers the white part of your eye and the inside of your eyelids.
Gotcha.
So it's not as scary as it sounds.
Okay, that makes me feel a little bit better. But here's where it actually does get interesting. So the article says that there isn't just one kind of pink eye. There are actually 3 main types.
Yes.
Bacterial, viral, and allergic.
And that's where that one-size-fits-all approach to treatment that we see all too often can really backfire.
Mm-hmm.
Thankfully, this article you shared, it breaks it down really well.
It does. And that's fantastic because, you clearly care about eye health. Which, let's be real, who doesn't?
Right.
So let's unpack these different types of pink eye, and more importantly, how to tackle each one, including those all-important eye drops.
Yes.
And of course, when a trip to the doctor is absolutely necessary, because, let's be real, sometimes even with the best intentions, Dr. Google just isn't enough.
No, 1,000%. Could not agree more.
So the article highlights 4 types of eye drops that I think a lot of us have probably used at some point.
Mm-hmm.
Sustain Ultra,
Yeah.
Ciprofloxacin,
Okay.
Aloe, and then there's Zergen.
A lot of options.
A lot of options.
Yep.
So Sustain Ultra.
Okay.
Sustain Ultra, that name just screams serious eye relief.
It sounds very intense, but Sustain is actually the most general of the bunch.
Okay.
Think of it as like the all-rounder,
Okay.
It's great for relieving symptoms like dryness and irritation,
Okay.
but it won't actually cure any type of pink eye.
So it's more like taking a painkiller for a headache. Makes you feel better, but it doesn't actually address the root cause.
Exactly.
Okay, I like that analogy. So if Sustain is our, everyday hero, then what about something like ciprofloxacin? That has a more, shall we say, targeted vibe.
Yes,
Yeah.
definitely.
Yeah.
Ciprofloxacin is a prescription antibiotic,
Okay.
so you know it means business. And the article mentions it's about 90% effective against bacterial pink eye.
Wow,
It's like the hitman of eye drops.
I was going to say, that's, really good.
Yeah.
Okay, I like that. The hitman for bacterial pink eye.
Yes, exactly.
But before you even think about, calling in the hitman.
Right. It's a really important point I do want to highlight from the article. Unnecessary antibiotic use.
Right. That is huge.
It's a big deal.
Yeah. Because it turns out a lot of cases of pink eye, especially the viral kind, they actually clear up on their own.
They do, within a week or 2, usually.
Yeah.
No intervention needed.
Exactly.
And that is why seeing a doctor is so crucial.
Yes.
They can help you figure out if you really need those prescription strength drops, like ciprofloxacin, or if your body is better off just handling it naturally.
Totally. So before you even think about grabbing the hitman drops, remember that a lot of pink eye clears up on its own. That's why seeing a doctor is key.
Mm-hmm.
They can tell you if you really need those prescription strength drops or if you're better off letting your body handle it. Which brings us to our next 2 contenders, Aloe and Zergen. Now, Aloe seems like it's in a completely different category.
It is. You're right. Aloe is our allergy avenger.
Okay.
It's available over the counter and specifically targets those itchy eyes that are caused by things like pollen and dust, pet dander, you name it.
So if your eyes are watering and you're sneezing up a storm, Aloe might be your new best friend.
Precisely. And then we have Zergen, which is a whole other ballgame.
Yeah, Zergen seems like the real heavy hitter.
You could say that.
Yeah.
It's an antiviral specifically designed to target herpes simplex viral conjunctivitis, which is thankfully less common.
Less common than something like the bacterial or even just like a regular viral.
Yeah,
Okay.
exactly. It's a little more specialized. But like Cipro, it is prescription only.
Okay.
And it can be a bit pricey,
Right.
depending on your insurance and things like that.
Right. Right.
Which, again, highlights why getting the right diagnosis from a doctor is so important.
Yes.
You don't want to be playing eye drop roulette when it comes to your health, right?
Absolutely not. Speaking of which, let's talk about actually using these eye drops. I'll be honest, I've definitely been guilty of just like squeezing a few drops in there without a second thought. It's the right way to do it. Asking for a friend.
You are definitely not alone.
Hey.
The article actually has a whole section on proper eye drop application.
Oh, really?
And believe it or not, it's more important than a lot of people realize.
Really? I wouldn't have thought that it was that big of a deal.
It can make a difference.
Interesting.
So first and foremost, and I can't stress this enough, wash your hands.
Okay, that makes sense. No one wants to, like, add more germs to an already irritated eye.
Exactly.
Yeah.
And I know it sounds obvious, but the article specifically mentions making sure your hands are squeaky clean
Okay.
before you even touch your eyes or the eye drop bottle.
Got it.
So hands washed, what's next?
Okay, yeah. What's next?
Make sure you're not wearing any contact lenses
Okay.
and that your eyes are free of any makeup.
Okay.
You want a clean slate, basically.
Okay, so far so good.
Then tilt your head back, look up towards the ceiling,
Okay.
and gently pull down your lower eyelid with your finger.
Like you're trying to show your eyeball to your forehead.
Exactly. You're basically creating this little pocket
Right.
between your eyelid and your eye.
Okay.
Now, here's the part that I find always trips people up. You want to hold the bottle upside down.
Wait, really?
Yeah.
I feel like I've been doing it wrong my whole life.
It's more common than you think,
Okay.
but holding it upside down actually helps to prevent contamination.
Oh, okay.
So once it's in position, you're going to carefully squeeze one drop
Okay.
into that little pocket that you've created.
Yeah.
And super important tip from the article. Try not to let the tip of the bottle actually touch your eye.
Okay. Good to know. I've definitely been guilty of that.
Yeah. I mean, we've all been there, but, you know.
It's a learning curve.
Exactly. And then gently close your eye.
Okay.
No squeezing.
Okay.
And here's another pro tip.
Okay.
Apply a little bit of pressure to the inner corner of your eye
Okay.
by your tear duct
Okay.
for about a minute.
Oh, okay. So that's what that little corner's for.
Exactly.
What does that do?
That helps the drops absorb properly.
Oh, okay.
It prevents them from just spilling out.
That makes a lot of sense.
Right.
Yeah. Okay, so we've got our drops in. We've resisted the urge to rub our eyes furiously.
Right.
What now?
Now we wait. If you are using more than one type of eye drop,
Okay.
the article recommends waiting at least 5 minutes between each one.
Okay.
That gives them enough time to really work their magic
Got it.
without getting diluted or washed away.
Makes sense. It's like giving each treatment its own like VIP moment on your eyeball.
Exactly.
Yeah.
But remember, as helpful as these drops can be, there are times when you absolutely need to see a doctor.
Right, because as much as we love our self-diagnosis and our at-home remedies,
Right.
there are those moments where you're just like, you know what, it's time to call in the professionals.
Yeah.
So what are those warning signs, those like, uh-oh, moments with pink eye where you know it's time to schedule that appointment?
Well, anytime you experience severe eye pain, that's a major red flag.
Mhm.
And we're not talking about mild irritation here.
Right.
If the pain is intense or it's not going away, it's time to see a professional.
Right, because sometimes it's not just your average pink eye. It could be something more serious.
Exactly. And speaking of serious, any changes in your vision,
Yeah.
huge warning sign.
Okay.
If you notice any blurriness, double vision,
Right.
anything that just doesn't seem right with your sight,
Yeah.
don't wait.
Don't mess around with that.
Don't mess around with that.
Yeah.
Seek medical attention.
Okay, that makes sense. So, severe pain, vision changes. What else should we be on the lookout for? So we've covered pain, vision changes. Are there any other, like, red flags, any other things we should be aware of?
Absolutely. Discharge.
Okay.
If you start to see any pus or any thick discharge coming from your eye, that's a sure sign something's up and you need to see a doctor.
That makes sense because, like, discharge usually means that there's some kind of, like, infection. Right.
Right.
Yeah.
And it could be something that needs a specific type of treatment.
Right.
That, you don't want to mess around with.
Totally. Anything else?
A couple more.
Okay.
extreme light sensitivity.
Okay.
Another red flag.
Okay.
And we're not talking about your usual, like, aversion to bright lights.
Right.
If even normal light is painful, it's time to seek medical attention.
So if you suddenly feel like a vampire and you have to, like, wear sunglasses indoors,
Exactly.
that's not a good sign.
Not a good sign. And, of course, if you develop a fever, along with a pink eye, that's your body's way of telling you that something more serious might be going on, and it's time to call the doctor.
Yeah. Fever, never something you want to just, like, ignore. The article also mentioned something about infants with pink eye.
Yes,
Yeah.
and this is really important.
Okay.
If you're ever around an infant who has symptoms of an eye infection, it is crucial to get them to a doctor right away.
Okay.
Babies can't tell us what's wrong, and their immune systems are still developing, so it's always better to err on the side of caution with little ones.
Absolutely. Better safe than sorry,
Exactly.
especially when it comes to babies. Okay, so we've covered a lot about eye drops, when to see a doctor.
Yeah.
But the article also mentioned home remedies for pink eye. Anything in there worth noting?
Definitely. Sometimes the simple things can make a big difference.
Yeah.
A warm or cold compress, for example,
Right.
can work wonders for soothing, itchy, irritated eyes.
Yeah, a warm compress always seems to do the trick for me. Just something about that, like, gentle heat.
It's very soothing.
Yes.
And if allergies are the culprit,
Okay.
doing your best to avoid those triggers is key.
Right.
So think air purifiers, washing your hands frequently, especially after touching pets.
Yeah.
Maybe even wearing sunglasses outside to protect your eyes from pollen.
Oh, yeah, that's a good one.
Just whatever you can do to minimize exposure.
Love it. And speaking of avoiding things, the article talked about how contagious pink eye can be,
Oh, yeah.
which seems super important, especially for people who work with kids or, are in close contact with others.
Absolutely.
Yeah.
Both viral and bacterial pink eye, they're highly contagious.
Yeah.
So in addition to everything we already talked about, like hand washing, not touching your eyes,
Right.
it's important to avoid sharing anything that touches your face.
Okay.
So towels, pillowcases, makeup, you name it.
Yeah. If in doubt, just don't share it.
Exactly.
And if you're the one with the pink eye, stay home.
Yes?
No one wants your germs, even if you're trying to be, like, a trooper about it.
Exactly. Staying home when you're sick is good for you, and it's good for everyone else.
So true. Okay, so we've thoroughly unpacked pink eye, I think it's safe to say.
We did it.
We talked about the different types, the best eye drops for each, when to see a doctor, even how to apply those drops like a pro.
Like a pro.
But you're right, the article really focuses on the immediate, like, I have pink eye, now what? Which is incredibly helpful, of course. Right. But it got me thinking, like, what about long-term eye health?
That's a great point.
Yeah.
This deep dive, this gives you the tools to deal with pink eye now.
Right.
But if you or your family are prone to getting it frequently,
Right.
that's a whole other conversation to have with your doctor.
Totally. Like, are there things that you can do to prevent it in the first place?
Right.
Is it a hygiene thing? Is it, like, an immune system thing? Is there some magic eye vitamin we should all be taking? Like, what's the deal?
Right. Are there predisposing factors?
Yeah.
Those are all great questions. And those are exactly the questions to ask your doctor. They can help you figure out if there are any underlying causes, if there are lifestyle changes that you can make, or even just things to be more aware of, based on your specific situation.
So there you have it. Another deep dive. Another topic tackled. We learned about the different types of pink eye, the best eye drops for each, and when it's time to call in the medical cavalry.
Yes.
But we didn't just scratch the surface.
We went deep.
We really went there.
We did.
Just like you asked. So until next time,
To be continued.
keep those eyes healthy and keep those questions coming.
See you on the flip side.